Are you a nursing student struggling to stay focused in class? Do lectures feel overwhelming and hard to follow? Don't worry, we've got you covered. This channel breaks everything down into simple, easy to understand lessons so you can study smarter, not harder. Welcome to the Nursing School Survival Guide. Let's get started. Did you know that proper hand hygiene can prevent up to 50% of hospital infections? As a nursing student, infection control isn't just a rule, it's a life-saving skill. Whether you're prepping for clinicals or reviewing for exams, today we're breaking down infection control and hand hygiene, made simple. Let's start with the basics. Why is infection control so important? In hospitals, patients are often immunocompromised, meaning their bodies can't fight infections as easily. As nurses, we're the first line of defense against spreading germs. Proper hand hygiene, PPE use, and infection control protocols protect both patients and healthcare workers. Now, let's talk about the number one way to prevent infections. Hand hygiene. There are two main methods: hand washing with soap and water and using alcohol-based hand sanitizer. But when should you use each one? Use soap and water when hands are visibly dirty or greasy, after caring for a patient with C. difficile, or norovirus, because hand sanitizer won't kill these germs, after using the restroom or handling food. Use alcohol-based hand sanitizer when hands aren't visibly soiled, before and after direct patient contact, before putting on gloves and PPE. Key tip: always follow the WHO's 5 moments of hand hygiene. 1. Before touching a patient. 2. Before performing a procedure. 3. After exposure to bodily fluids. 4. After touching a patient. 5. After touching patient surroundings. PPE and preventing cross-contamination. Infection control goes beyond hand hygiene. Using personal protective equipment, PPE, correctly is just as important. Here's a quick breakdown. Gloves. Protect your hands, but remember, gloves aren't a replacement for hand washing. Masks. Prevent the spread of airborne and droplet infections. Think TB or COVID-19. Goggles and face shields. Protect your eyes from splashes. Gowns. Prevent contamination of clothing during high-risk procedures. Key rule: always don and doff PPE in the correct order to prevent self-contamination. If you're studying for exams, infection control is a top NCLEX category. Expect questions about standard versus transmission-based precautions, contact, droplet, and airborne, correct PPE use, which order to put on and remove, and hand hygiene protocols. A common test trick: NCLEX loves to ask about what to do first in infection control scenarios. If you're ever unsure, hand hygiene is usually the right answer. Infection control is one of the simplest and most powerful ways to protect patients and yourself. Mastering these skills now will make you a better nurse in the future. If this video helped, hit the like button and subscribe for more nursing school tips. And comment below what other videos would help you on your nursing school journey.